Hello, my name is Sarah Lawrence, and this is my Spirituality and Liberal Arts video. The educational opportunities that the liberal arts curriculum have provided are invaluable to a bachelor-prepared nurse. The values and knowledge that I have obtained through this curriculum will be demonstrated throughout this video. First, I will describe 3 ways in which I have integrated principles from the curriculum into my own personal, professional nursing career. Next, I will provide 2 examples of how I plan on engaging in lifelong learning after completing my BSN. Next, I will address ways that I will act as a servant leader towards my patients' families, coworkers and peers, and towards myself in my own personal life. Last, I will discuss how learning about spirituality and spiritual reflection within this nursing program have impacted my views on providing holistic patient care. I will first describe 3 ways in which I have integrated principles from the liberal arts curriculum into my own professional nursing career. There are many ways that one can integrate the liberal arts curriculum into the nursing practice. However, I have chosen to discuss these 3 areas that I have encountered frequently in the short time that I have been a registered nurse. First, I have utilized the communication skills I have learned through completing liberal arts classes to communicate effectively. Effective communication in nursing involves face-to-face or telephone communication with patients, family members, physicians, and all members of the healthcare team. It also involves nonverbal communication skills, which are required when helping those individuals who have communication barriers due to age, disabilities, medical conditions, or any other language barriers that may be present. Nurses also rely heavily on technological means of communication through the electronic healthcare record. Second, I have applied the knowledge that I have gained from liberal arts classes to help develop my own personal value system and ethical decision-making principles. Unfortunately, while working in healthcare, ethical situations do arise. The valuable lessons and principles that I have learned through this program have better equipped me to be able to handle these situations in the most compassionate, professional, and ethical way possible. Third, I have integrated what I have learned about behavioral and psychological conditions and illnesses into my nursing practice. I took many classes relating to the study of psychology before attending nursing school. Mental illness is becoming increasingly prevalent and is frequently encountered within the healthcare field. I have used my previous knowledges in classes I have taken about mental illness in order to better understand and care for these individuals who need extra care or extra help in these areas. Next, I will provide 2 examples of how I plan on engaging in lifelong learning after completing my BSN. The healthcare environment is always learning, growing, and changing. As nurses, we must adapt to these changes. The nursing profession is a profession that requires lifelong learning. First, I plan to engage in lifelong learning by focusing on evidence-based practice. I plan to continue to do research about the current evidence and about new evidence and best practices even after graduating with my BSN and continuing throughout my entire nursing career. I hope to expand on my knowledge and always be up to date on best practices and how the new evidence compares to and changes current practices. I also plan to advocate for the use of evidence-based practice within the clinical setting and implement it into my own nursing practice. Second, I plan on furthering my burn-specific knowledge by attending next year's National Burn Conference. I currently work in the Burn Trauma ICU, and every year a group of nurses from our unit attends a National Burn Conference. The conference consists of nurses, physicians, drug and product representatives, physical therapists, occupational therapists, scientists, researchers, and burn technicians, and many others who gather in hopes to share and gain knowledge about burn care. The conference also focuses on new medical advancements, innovations, and further treatment options for burn patients. Next, I will address ways that I will act as a servant leader towards my patients, family members, peers and coworkers, and within my own personal life. I will act as a servant leader towards my patients by working to integrate all that I have learned throughout completing my associates and bachelor's in nursing to provide the most compassionate and competent care to my patients' physical, mental, and spiritual well-being. I strive to go above and beyond for my patients, whether this means taking a little extra time to ensure they understand all there is to know about their medications, or by completing and teaching extensive dressing changes. I also hope to lead and encourage my patients to make good choices and to be active participants in their own medical care. I will act as a servant leader towards patients' family members by always being intentional in the way that I speak to and present myself to family members. I will listen to their thoughts and their concerns and include them in their loved ones' care and decision-making when appropriate. One example of servant leadership opportunity on my unit, the burn unit, is that we frequently teach patients and their family members dressing changes so that they will be prepared when they get discharged from the hospital. I must act as a leader and must set a good example to promote clean technique and optimal wound care. I will act as a servant leader towards my coworkers and peers by treating every member of the healthcare team that I encounter with the utmost respect. I will also work to always be an excellent team member and leader within my unit. Providing care to complex and critically ill patients requires that healthcare professionals work as a team and collaborate in order to provide safe care for all patients and to maintain patient continuity. I have also begun working as a charge nurse on my unit, and I must work hard to fulfill this leadership role to the best of my ability. I will act as a servant leader towards myself and within my personal life by always prioritizing my needs when necessary and taking time for myself when outside of work. I do this at work by remembering to show my mind and my body kindness through using good body mechanics techniques during dressing changes and while lifting patients, taking breaks when I know I need them, and knowing my individual strengths and weaknesses. I do this at home by remembering self-care and by participating and enjoying my hobbies such as reading, crafting, hiking, skiing, and spending time with my husband, my friends, my family, and my dog. It is also important to be healthy physically, mentally, and spiritually within my own life in order to lead by example to my husband, family, friends, coworkers, and patients. Last, I will discuss how spirituality and spiritual reflection utilized within this nursing program have helped me to learn and have impacted my views in providing holistic patient care. Before completing this program, I did not fully understand the value of providing spiritual care to my patients. However, through the completion of this nursing program, I have truly seen the importance of providing spiritual nursing care. Spiritual beliefs impact patients' overall views on birth and life, health and wellness, and illness and death. Patients' spiritual or religious beliefs can affect their diet, treatment options, and many other aspects of their overall care. I have learned that as nurses, we are called to provide holistic care, which means caring for the patient physically, mentally, and spiritually. It is also important to participate in self-reflection to examine our own personal strengths and weaknesses, beliefs, and spirituality, and how our personal beliefs translate into the care that we provide to patients. In conclusion, a liberal arts curriculum is extremely beneficial to a BSN prepared nurse in many ways. First, the knowledge learned from taking liberal arts classes is easily integrated into the nursing profession and can be used throughout the entire nursing career. Next, this program has always emphasized the importance of engaging in lifelong learning and acting as a servant leader to all that we come in contact with. Lastly, the importance of spirituality and spiritual reflection in nursing have been made evident through the completion of this program and will help me to always provide patients with compassionate and holistic care.